Welcome, everyone. This is Kate with WorkSmart.org, and today we have a very special guest. Her name is Megan Coates, and she has a remarkable health story and she is still in the process of that journey, as all of us are with our health. We never want that journey to end, and she's going to share with us what she's been through and sort of almost a before her health crisis and now currently what's happening. And I think you will find it very inspiring. And Megan is planning to attend our 2020 Fork Smart Summit with her mother. So I think it will be quite incredible that you'd be able to say hello to her at the summit as well. So welcome, Megan.
Thank you so much. I'm happy to be here.
And you're living in what part of Alberta?
So Edmonton, the West Edmonton area. Yeah.
So that's wonderful that you're going to make the trip down to the summit.
Oh yeah, I wouldn't miss it for sure. I was so excited. Especially when I heard McDougall was going to be there, I was like, I have to go.
So I received an email from your mom who wrote on behalf of both of you, just saying that you had gone through a very major health crisis. And I'm going to let you share what that is, and that you were interested in coming to the summit. So I was so glad that you reached out, because your story is quite remarkable.
Thank you.
And I think it would be very of interest to lots of people who are struggling with a particular illness or disease. So could you share with us what you've been through a little bit?
Absolutely. So I do have MS. I was just diagnosed last January after suffering one of the worst attacks that my doctors had ever seen. Beginning of January 2018, I was in Disneyland going on roller coasters, like running around the park. A couple weeks after I got home, I became paralyzed, blind in both eyes, and then was in and out of the emergency about 4 times. So I spent about 4 weeks in the hospital, 4 months. So 2 months in an acute care hospital, 2 months in a rehab hospital.
Right. 4 months, that's a long time.
It is. Yeah, the majority of, or like a good chunk of the year for sure.
Yes.
Yeah, so it happened just a couple days actually after I got back. So this was the beginning of December. I was doing my makeup because I worked as a makeup artist and a blogger. And I noticed that the left side of my face wasn't moving. So I would smile and the left side just didn't do anything.
Yes.
Of course, I did the worst thing you can do. I Googled it and was convinced I was having a stroke. So called an ambulance, went to the ER. They did a whole bunch of tests, said, nope, wasn't a stroke. They thought I might have a condition called Bell's palsy, which is like a paralysis of part of the facial muscles.
Yes.
Then determined it wasn't that after they did a CT scan and saw some lesions or scars on my brain, but they weren't able to get me in for an MRI yet. At the time, I could walk, I could see. I was just kind of tired, but otherwise I was fine. So they sent me home. I had my MRI on December 17th, and I noticed as I was leaving the MRI, walking back to the car, we had parked pretty far, it felt like my legs were just not cooperating. I was actually having a lot of difficulty walking.
Oh my God.
I thought I was just really tired, but it felt like I was so tired. My legs felt so heavy, and my boyfriend had to actually help me back to the car. And then just a few days after that, I started to have so much difficulty walking that my auntie had to let me borrow an extra walker that they had so I could get around the house.
Right.
And so from December 11th to January 2nd, I was in and out of the ER a few times, each time getting significantly worse. By that 4th time, I was paralyzed. I couldn't move the left side of my body at all. I couldn't sit up, I couldn't stand, I couldn't walk. I could barely move my right side, and I was almost fully blind. But they kept sending me home, saying, oh, well, we think it's MS. Based on your MRI and your CT scan, it looks like you're having some demyelination, so it's affecting your nerves. But if it's MS, the best thing to do would just be go home and rest it off. Of course,
for those people who maybe don't know about MS, that there's flare-ups, right? People can have flare-ups, and they can wake up with having vision problems, having muscle weakness, and even paralysis.
And that's what was happening to me. But they thought, you just need to go home and rest it off. By this time, it was almost New Year's Eve. So they
Yes.
were like, you don't want to spend your New Year's in the hospital, like go home and rest.
Yeah.
But by that point, I couldn't even take myself to the washroom. My parents had to basically lift me up onto a walker, push me to the bathroom, and then help me in the washroom.
Yeah.
So by January 2nd,
And how old are you, Megan?
I am 24. I actually turned 25 on February 8th. So at the time,
Congratulations.
I
Yeah.
was 23. So
Yeah.
it was
So
mortifying.
imagine a 23-year-old having to have their parents
Well, exactly.
take them to the washroom and take care of them, their washroom needs as well. That's really
it was mortifying.
pretty devastating to say the least.
Yeah.
And that's minor compared to the paralysis, the blindness.
Exactly. It hadn't even hit the worst of it yet.
Yes.
Then by January 2nd, I was fully paralyzed. I couldn't sit up. I'd lost all control and strength in my body. So when I would sit, I would just slide out. Like I was like a jellyfish. I couldn't even keep myself upright. And I had become almost fully blind in both of my eyes. So they had a home care nurse come to assess me because that's what the doctors suggested. She took one look at me and she was like, no, she needs to go to the hospital. There's nothing that I can do for her. So they took me back to the ER, waited there for a few hours. At that time, I couldn't stay awake for more than a couple minutes at a time, so I was barely conscious. My parents and my family would try to wake me up long enough to get like a smoothie or just some nutrition, but because I wasn't able to stay awake long enough to eat or even feel hungry, my muscles were deteriorating. I'd actually lost 20 pounds in about 10 days just from basically wasting away.
Yeah.
Yeah, so it was a few hours in the ER. Of course, they were talking about sending me home again, and my family were throwing a fit. My mom was making quite a scene, understandably. She was devastated. She was like, no, you are not sending her home again.
Yeah, especially under those conditions.
Well,
I mean, if home care nurses are feeling it's overwhelming and that you need to be in a acute medical setting to get treatment, and then to have your parents, I can imagine your mom.
Oh, she was hysterical.
Yes, and that thank goodness she was advocating. That she found her voice.
Well, so and luckily, a neurologist happened to be passing by the ER. She's not usually there. She heard the commotion, took one look at me, at my scans, and she was like, oh my God, she needs to be admitted. She needs to be started on treatment right away.
Wow.
So thanks to her advocating for me, she got me admitted. They started me on a very high dose of corticosteroids, a plasma exchange. So they stuck a tube in my chest to filter out basically my blood, separate my plasma, get me new plasma. So I had alternating 6 treatments of each. And yeah, at the beginning, like because I not only was blind and barely conscious, but I couldn't really control my body. The first few days, my boyfriend was not willing to leave me alone. So he and my family kind of alternated staying with me, but he stayed with me every night, even when the nurses...
incredible support network.
Absolutely. I'm so lucky.
And that's your boyfriend, Shane.
Who is an angel.
You know he has wings, right?
That's what I've been saying. Yeah,
and thank goodness, because you really didn't have. I mean, you were kind of encased in your body at that point.
Well, that's exactly it. And honestly, I remember barely anything from that first week because I just basically slept the whole time. My body was just undergoing such an attack that it was just like shutting down.
Yeah, and sometimes that does happen even with our people maybe familiar who had longer stays in hospital and they've been quite sick will get kind of a delirium that their brain just shuts down because their body's overloaded then with trying to heal. That it just needs that time. And in a way, it reduces perhaps a little bit of trauma for you, certainly not having to remember every issue.
Well, I mean, they had to do, they did 2 MRIs and a spinal tap to actually diagnose me with MS. I don't even remember the spinal tap, so in a way, I guess that was a positive, because I slept through it.
Yeah. But I'm sure, what effect did this have on your family just at that time to see you going through all this?
Oh, they were terrified. My mom, especially, like, she had lost a child previously, so I'm an only child, and she was like, I'm not losing another child. Like, she was just a mess, understandably. Everyone was pretty terrified. My
Yes.
aunt and my boyfriend had to basically fight with the doctors and nurses there to let him stay in the room with me because
Yeah.
I wasn't conscious. I couldn't, like, there were several times where I would try and move, I guess, while I was sleeping. My legs would slip off the bed and I would start dragging myself off the bed and almost fall out of bed. I don't remember that, but he
Yeah.
luckily caught me and called the
Yeah.
nurses in to help get me back in bed.
Wow.
But
So
I
he was
couldn't do
really the
anything.
eyes and ears,
Oh,
you know,
100%. Yeah.
and I think people who've ever had a big challenge like you have with this medical crisis realize what a difference that makes to have someone
For
who's
sure.
going to be your voice
Yeah.
for a time.
I don't know
Yeah.
how I would have gotten through it. Like, I couldn't feed myself. I couldn't
Yeah.
get myself water. I had to be fed for every meal. I needed help brushing my hair, getting dressed, everything. So I
Right.
needed like 100% around the clock care. I couldn't even do anything to entertain myself because, of course, I couldn't see. So
Right.
he would set up like audiobooks and podcasts and videos
Yeah.
for me to listen to because
Yeah.
there was really nothing else that I could do.
Yes. And then you went from an acute care setting to a sort of rehabilitative setting
Yeah.
for 2 months as well.
That's right. So at first, they were having trouble diagnosing me because while they looked at like all of my tests and everything and believed it was MS, they hadn't really come across a case that bad. So they initially suspected it might be fulminant MS, which I had never heard of before until I got to the rehab hospital, which is actually the most malignant form. It's the most dangerous form of MS that often results in death within the first couple weeks.
Yeah. So you really are a walking miracle.
Thank you. I definitely feel very lucky.
Yes, I mean, it's a real blessing that you've been able to get through this. What do you think has also helped? I mean, I know that you've gone through rehabilitation, which meant that you had to learn how to walk and do those basic skills that we often take for granted. What also do you think that you did to help? You know, I know those are all traditional medicine type of activities. Are there things that you did outside of traditional medicine to be of help to you?
Absolutely. So initially, you know, the medication treatments were crucial in stopping the attack, but in allowing my body to help accept those medications and treatments more effectively. When I was in the rehabilitation hospital, I started learning about more specifically like a whole food, plant-based, really nutrient-dense diet and how effective it could be for diseases like MS specifically. I came across the studies of Dr. Roy Swank and Dr. McDougall. Dr. Roy Swank was a very, very prominent neurologist. He was actually the head of neurology at a hospital in Oregon, and he studied his patients for over 50 years. And it showed conclusively that patients who had a diet lower in saturated fat and cholesterol, higher in plant-based foods, had the lowest rates of relapses, lowest disease, and death rates. So that right there was enough for me to say, okay, well, I need to focus on my nutrition as much as I can. That's the one thing that I can control. Once I got home, of course, that was a lot easier because in the hospital, you don't have access to the best foods, unfortunately.
It can be very difficult.
Yeah.
Yes.
So, I mean, I had a lot of free time. I basically poured myself into learning as much as I could about nutrition. Started focusing on getting those really nutrient-dense plant foods every day as much as I could. And I am so happy to say that as of July 2019, my disease stopped. So my MRIs show there are no new lesions, none of them are active, and they're actually reducing in size.
Wow, congratulations.
Thank you.
Do you feel like that had more to do with do you think one or the other? Like, do you think it's drugs that you've been on, or do you think the plant-based diet really made some difference?
I think it's a combination because based on what I've learned about the studies of Dr. Swank, he showed that a diet, specifically a whole food plant-based diet, was actually more effective than any of the leading drugs. The leading drugs only have about a 45% efficacy rate, whereas dietary changes had over an 80% efficacy rate.
Wow, so double.
Exactly.
So that really, you really helped to accelerate your healing then.
That's what I believe.
Of putting food first. Can I ask you, with regard to, was this a diet that you had been on before? You sort of said you discovered it, you had more time.
Right.
What kind of foods were you eating prior to this?
So I had been vegan since about 2016, but more so for ethical and environmental reasons. Health,
Right.
I was starting to learn more about, but I definitely didn't have the best diet. I was still eating a lot of processed, vegan junk food.
So I call that the
Mhm.
sad vegan, because what we,
Yeah,
that
exactly,
makes sense
exactly.
to people who are also watching that. The
Yeah,
reason I call it the sad vegan is people are just substituting meat and dairy for
yeah,
fairly highly processed fake
yeah,
meats, other
exactly.
things like that that are
Hmm.
really actually pretty hard on our body. And
They are,
if
for
people
sure.
actually looked at the ingredients list and also the dietary sort of analysis,
Hmm.
they're very high in fat,
They are.
unfortunately.
So while I
You know,
was eating more vegetables and,
it's,
good foods than I had in my childhood, because I grew up with a self-proclaimed carnivore dad eating a very
yeah,
much standard American diet, a lot of bacon, a lot of sausages, hot dogs,
yeah.
just foods that are not health promoting at all. So
Which a
it
lot of us
was
had
an
grown up
improvement.
with and thought that that
Exactly.
was
That's what I
the
thought.
best thing to
Yeah.
feed our kids, or
Yeah.
best thing to be fed.
Yeah. So they were kind of
Yeah,
transitional foods, but like while it did help, cutting out the dairy, cutting out the meat helped
yes,
significantly clear up my irritable bowel syndrome and my acne at the time.
yes.
It wasn't as health promoting as it could have been. And I was also starting to realize I'm pretty sure I am sensitive to gluten and it's irritating my stomach. And I was eating, a lot of gluten containing foods. And I started
Yes,
to notice that even though my IBS had gone, I would feel very bloated.
yes,
Just not the best after. And of course, while I was in Disneyland right before I got sick, I was feeling like I was fighting a cold or an infection of some sort. While I was
yes.
there, I actually got hit with a really bad cold. Of course, you're in Disneyland. I was eating a lot of junk foods. Even if they were vegan, they were still full of sugar, full of fat.
Yeah.
Not great. But yeah, ever since I changed my diet to eating a whole food plant-based diet, like as healthy as I can, my
Yes.
MS symptoms are virtually gone. Other
Amazing.
than,
Well,
yeah.
and you're probably familiar with Dr. McDougall's study that he did with University of Oregon with MS patients.
That's
And
exactly, yeah.
he was able to do, he had enough funding to do about a year-long study.
Right.
And my understanding from that study is that patients themselves in the self-reporting that, and also through blood tests, that their cholesterol went down.
Oh, absolutely.
Their blood sugars were stabilized.
Yeah.
And that they reported that they felt more energy
That's
than
exactly
they had been before. Now, the one thing that when he did the scan, and unfortunately those are very expensive to do.
Oh, they are, yeah.
They didn't see a change in the lesions, but now hearing your story is quite amazing. That through the scans that they can do, that they find out that they're not active and that they're shrinking.
Well, exactly. And I mean, with the lesions, they don't, just magically go away, unfortunately. No. But the main marker of disease activity is, are there new ones? Are they active? Yeah. So are they lighting up with the
Which actually really reminds me of heart disease.
Exactly.
Dr. McDougall will talk about that. Some people can have hardening of the heart quite severely, but guess what? If it leaves undisturbed and you continue eating a whole plant-based diet, you're not going to create more plaque.
Exactly. So
that it would may be dangerous to even go in and try to remove that plaque.
Right.
But instead be aware that you are using food as a preventive tool as well.
That's exactly it. And I knew the whole time, I'm not expecting any magic cure. Unfortunately, we don't have a cure for this disease yet. But I knew I need to do what I can do to give my body the best chance of fighting this. And it's even more important to me now because, of course, being on a high dose of corticosteroids, being bedridden, basically just eating the whole time because they make your appetite crazy. I gained about 60 pounds. So that's very frustrating, but considering that they helped save my life, I guess it is a side effect that I'm willing to deal with. But it's definitely helping me, the diet, in terms of all of my symptoms. So, of course, I am still visually impaired, although my vision has improved to the point that I'm able to do most things. So originally it was worse than a 20/400, which is definitely legally blind.
Yes.
In the last year, it has steadily improved. It went from that worse than 20/400 to 20/200. 20 over 100 in September, and it's now a 20 over 70. So it is improving.
Congratulations.
Thank you.
Yes.
That's part of what stumped the doctors, is that it affected both of my eyes at the same time with optic neuritis, which is very common with MS, but it is very rare that it affects both eyes at the same time. So that's kind of what stumped them. They thought I might have another condition called neuromyelitis optica, or NMO, but based on all the tests, it appeared to be more MS than that.
Right.
They were just,
and I think you've really highlighted that medicine isn't an exact science. It's more like detective work, a process of eliminating other things that they think, because we can have symptoms that can be representative of a number of diseases, and they have to keep eliminating.
And I think that was part of the difficulty. I mean, looking back at my symptoms, they started in my childhood. So things like my first symptom was an overactive bladder. The doctors chalked it up to, oh, you just have an overactive bladder. Now we realize, looking back, I actually had a lot of symptoms that I wasn't aware of. So over the years, especially like 2012, 2013, my fatigue and the mood issues that can be affected with MS, because of course it's causing changes to your brain. So the anxiety, depression, that was making it really difficult for me. I actually wasn't able to finish. I was doing like a Bachelor of Arts degree at the U of A here. And I was just having such a hard time. I had no energy, no motivation. I dropped out. I couldn't finish it.
Yeah. So
the signs were definitely there. But for years, I've been complaining to my doctor, my legs are so tired and achy. I'm 20, 21, 22. I should have so much more energy than this, but I don't. I'm tired all the time. And
I think, you're bringing up a really valuable point, Megan, and that is that many times we may think that, we sort of, as you said, when you're younger, you just chalk it up to something and you kind of go along.
Well, exactly.
And you think that you're healthy enough. And when in fact, part of you is saying, hey, this doesn't make sense.
Well, and that's exactly it. I almost felt like I was being like a hypochondriac, because I would continuously go to my doctor saying, something is wrong. Like, I don't feel right. They would do blood test after blood test. They thought, oh, maybe it's a B12 deficiency because you're a vegan. But my blood tests all looked great. I had no deficiencies. My blood sugar, everything was normal. Once a resident a couple years ago actually said, depending on what your blood tests show, we might actually consider testing you for MS. So he had actually mentioned it to me, but then it was never brought up again. So, of course, I didn't want to worry myself. I had Googled it, looked at the symptoms, and I was like, oh my God, I have MS.
I can understand why denial would come in really big.
Exactly.
And, because that's really scary to hear something about like a chronic disease.
Well, exactly. And I didn't really know much about it. The only really experience I'd had is I knew a couple people who are now in wheelchairs. So I was like, nope, that's not me. It can't be me. The doctors would have told me.
Yeah.
Of course, lo and behold, it was. I definitely wish we had caught it sooner. It likely would never have progressed to the stage that it did. But luckily, they were able to fully stabilize me. And my neurologist, the one who decided on the treatment that saved my life, she is shocked. She even said, she's like, this is better than we could have hoped for.
Wow.
Yeah.
Well, I think, that's the one thing that I think that people forget, is that I'm just wondering about your sense of empowerment, that you could, traditional medicine, and especially in an acute situation, can be extremely helpful. I don't think there's any whole plant-based doctor who would ever say, don't bother going, just use food. They would say, no, you need that. There's reasons and there's times to use that. However, how does that make you feel by way of empowerment as a patient?
At the time, I felt so helpless. I'm lying there. I couldn't do anything for myself.
Yeah.
I'd lost all of my independence and really my sense of, it's very almost demeaning or dehumanizing to have to call a nurse to take me to the washroom, have to shower me, everything. So at the time, I felt completely helpless. But once I started to learn, there is actually more that we can do to help ourselves. And when I started to see those effects, I felt I actually have so much more power to help myself in this situation that I can't control. I can't control that I have MS, but I can control how I respond to it. And that was kind of my mindset the whole time. Even when I was at my worst in the hospital, People would say to me, how are you being so positive? How are you, staying sane? And I'm not going to lie, it was definitely a struggle. I had my moments where I was very down, very upset, terrified.
Makes total sense.
Yeah, especially when the doctors, like my neurologist is telling me, we need to be realistic. To be honest with you, we don't know how much vision you'll ever get back. You might spend the rest of your life in a wheelchair and blind. That was crushing to me because my career, everything that I've worked so hard for, trained so hard for, is visual. So to hear those words, that was worse to me than hearing you might be in a wheelchair for the rest of your life.
Yes.
I was like, that, I can deal with that, but if I can never...
hearing the multiple losses.
Exactly.
Your occupational loss, you're something that you also enjoy. Because I know that you do makeup, but also a lifestyle blog.
Well, exactly.
Travel and other things.
Photography, videography, like graphic design to an extent, everything. And I just thinking everything that you love might be gone. That to me, I was like, no, that's not okay. That's not good enough for me.
So that sounds like what you did is you decided to take that as a real fight on to say there must be some other things that I can personally do.
Yeah.
And that's something that's very powerful. Our fork is very powerful.
I agree.
Even the fork in the road to make the decision. And do I just go along with this is my destiny, this is what it is? Or do I say, just a minute, I have a chance to try to do some things? And you kind of put on your researcher hat and experimented and tried eating
absolutely.
more than to sort of see what would happen. And you've been a great researcher because you found out like incredible data as a result of conducting your own study.
I've always been the kind of person where, okay, if I'm going to do something drastic, I need some evidence to support it. And that's why I decided, okay, if I'm going to be drastically changing my diet, even when I went vegan, I need the facts, I need the evidence, I need to know what I'm doing, I need to be prepared, I need to know as much as I can.
So it's more important for you to know some of the whys behind that.
Exactly.
Before you get into the house.
Exactly.
Yeah.
Well, and like I said, it's so powerful.
Can I ask what impact that had on your family when they started to see, just by you making those dietary tweaks, I'll say, because, going from a sad vegan to a fully whole plant-based person, which is really a description of how we eat, what's on our plate.
Of course,
what impact did that have on your boyfriend, your family? Have they considered eating this way, or? So
my mom actually went vegan with me back in 2016. Hers was for more so kind of health, but also environmental interests. She has like a chronic inflammatory disease, and she also was suffering with gallstones. So she found that it really helped her. She's always been really good at eating a ton of vegetables. So I think at the time she was probably eating better than I was. But when she started to see how much better I was doing, how my symptoms were getting so much better, I mean, she saw me at my absolute worst, unconscious, paralyzed in bed. And now for her to see me being able to cook a meal for us, being able to do so much, she's definitely a believer, and she's supported me this whole time. Some of my family, of course, think the whole vegan craze is a fad. One of my family members actually was convinced that the whole reason I got MS was because I was vegan. I had some sort of crazy protein deficiency, even though every doctor, every nutritionist there was like, no, that's not how it works. And they knew that I had MS going back to my childhood. It just hadn't fully developed yet. But they believe what kind of triggered
eating the bacon and the sausages and all that other stuff, ironically.
And they believe that what triggered the attack was a series of infections, colds. I had mono a couple years ago, and I never really felt like I recovered from that. But I was also doing allergy shots, allergy immunotherapy, and that is stimulating your immune system. And of course, MS is a disease where the immune system is overactive and attacking your own body. So they said to me, you need to stop those. You can never do those again. Of course, I only was doing them because I love dogs so much and I am allergic. But I was like, I'll do whatever I can. So it is, I wish I'd known that could potentially happen before, but you don't know until it happens, right?
No, unfortunately, sometimes our knowledge comes after the fact of something.
Well, and I do want to mention, because I'm not trying to demonize the allergy therapy, because it doesn't cause MS, but if you already have a demyelinating condition that's brewing, like MS, it can worsen it. So that's
So
what
it
happened
can
to me.
accelerate it, perhaps,
Exactly.
as a result, unfortunately.
Yeah.
So that's something for someone to keep in mind, that maybe they need to do some screening before they consider doing
Oh, absolutely.
this other service, that other intervention of having allergy shots. And it's a really good, that's a really helpful flag for people, because sometimes we go blindly into things without investigating.
Exactly. And I mean, they did screen me, but because I didn't know that I had MS, we had no idea that this was brewing deep inside of me.
Yeah.
We had no reason to like be scared or be cautious.
No.
But I kind of wish I had thought about it more.
Sure.
Definitely.
Sure. Yeah. So I'm, and I just wonder, because you've been in, with makeup, it is exterior.
It is.
Of course, there's things. I mean, your body is kind of glowing with the foods that you're eating. But John McDougall talks a lot about the fact that even people skin improves.
Oh,
and I'm just
absolutely.
wondering if you've noticed a difference in
that
your skin.
That was something that I noticed. Back when I first cut out the dairy, I had acne all throughout my teenage years, and it was hormonal acne. So once I cut that out was when my skin first started to clear up. While on steroids, it's very common for people to experience really severe breakouts. I did break out, but it was very mild. And even now, as I'm still trying to get my body back to normal, my hormones back to normal after all the medication, I do get a couple blemishes, but nothing like what most people get.
Wow, which is amazing.
Yeah,
so
I'm very grateful for that.
I mean, that's interesting, because, there are people that will need to take steroids for a particular reason, disease, intervention, and to be able to know that their diet could even help with reducing some of the side effects would be great.
Absolutely. And I mean, there is actually a lot more research than I ever expected into how our diet can affect our skin, specifically foods that affect your hormones, like the cow's milk and the dairy products, of course, are one of the leading contributors to acne and to skin issues. And I also had eczema my whole life. I used to get it so bad that I would get it along my sides. Oh, sorry, I had a hiccup there. And it would be so bad as a child that I would have to miss school sometimes because I couldn't even put a shirt on. It would hurt my skin.
Oh, gosh.
Now, luckily, my eczema has cleared up everywhere except my hands, which is really just because my bladder is overactive that I'm washing my hands so many times. But I don't have eczema anywhere else. I used to get it on my face. I would get it under my eyes and on my cheeks, and I don't have that anymore, thankfully. My dry skin, oily skin, my skin was all over the place, and that has improved so much.
Sort of evened out now. And
exactly.
And I think people forget that we don't think of skin as an organ, but it's the largest organ in our body.
Absolutely.
And it needs care and attention, and we sort of forget that. And I think too is a lot of people think that they mistakenly need to add oil to somehow get, like, we think about dogs and cats, a shiny coat, where in fact, we would be shiny because the oil will actually come out when if you never notice someone who's eating a lot of oil-based products, like, a lot of fat products, like in meat and cheese and French fries and potato chip, it's actually in chocolate that it's coming out through their pores too.
Exactly. Yeah.
So it's actually not very helpful for us.
It's not
at all, and then let alone what it's doing on the inside of our bodies.
Exactly.
And what it's going through. So I'm just wondering, before we end our time together, people might be curious about what kind of maybe are some of your favorite meals or favorite go-to things to eat.
My diet right now, because I am focused on losing that steroid weight, is a very, like I said, nutrient dense. So sort of taking the principles from Dr. McDougall, Dr. Greger, and Dr. Joel Furman. And just kind of combining as much as I could of the most densest form of nutrients. So a lot of soups, stews, curries, smoothies, everything, tons of salad. I have salad every day, which I notice the days that I have a good salad with tons of greens and onion and seeds, all that good stuff, that's when I feel the best.
Wow.
Yeah.
Yeah. So those are your go-to things. And then are you doing any, now McDougall is well known for his weight loss.
Yeah.
where he suggests go off flour products, even if they're
Mm-hmm.
whole grain flour products.
Yeah.
Is that something that you're, and I noticed that you mentioned about gluten,
Yeah.
was if you have a bit of, whether it's an intolerance or a sensitivity to it,
Mm-hmm.
are you doing any of that as well?
Yeah, so even though they weren't able to fully diagnose me with celiac disease, which I'm grateful
Yeah.
for, they do know that I have sensitivities. And we
Yeah.
do also know now that if you have sensitivities, certain foods that are more processed, like the gluten, for example, can actually increase the permeability of your intestines and can sort of aggravate inflammation. So I try to avoid it as much as I can. I do notice, though, when I do have something more rich in gluten, say it's a bread or a pasta, my hand will actually get numb and my symptoms will actually get worse for
Yeah.
usually like the 12 hours after. Like my
Yeah.
hand will go numb during the night, whereas when
Yeah.
I avoid those foods, that doesn't happen to me.
Right.
So I mostly stick to like the whole unrefined starches, things like
Yes.
potatoes, sweet potatoes, things like that. If I do have, I'll have like some brown rice or wild rice. I love, it's probably my favorite, but
Yeah.
I don't really have much for bread. We will occasionally get like a whole grain gluten-free bread. My mom really likes, once in a while having some like peanut butter and banana on some of that is definitely one of my favorite easy breakfasts.
Yeah.
But I'm trying to make it as nutrient dense as I can, trying to make the calories go as best as they can.
Yeah.
And just thinking everything I'm putting in my body, okay, is this helping me? Or am I just enjoying like a few minutes of pleasure for something that's not helping my body?
Right. So you're constantly like kind of, looking at that issue of choice.
Exactly.
Do I go toward, my value of I want as much health as possible, I want to feel as good as possible, or away from like I just need that pleasure kick.
Exactly.
And so you're making that choice all the time, which many of us do when we're faced, if we're under stress or difficult feelings or thoughts. We end up sometimes going away from the very things that we value because we're looking for kind of short-term comfort,
Exactly.
rather than look at long-term benefits.
For sure.
So I congratulate you on even allowing yourself to stop and think about the choice that you're making.
Of
Because
course.
sometimes we go on automatic pilot, unfortunately.
Right. And it's
don't
not
realize.
easy all the time. I am also a believer that we're human. We do need to enjoy our lives. So if that means an occasional treat, maybe something that wouldn't be considered, whole food, I don't think that's the end of the world, but I want my diet to be at least 95% the best that I can. Because I feel the difference when I don't.
That's really helpful. I mean, Dr. Esselstyn and Dr. McDougall will talk about it's better to have fruit for dessert, but every once in a while you might have, there's a birthday coming up or something. It's not unusual to celebrate with a birthday cake, and we don't have to beat ourselves up for that. Because that's really, when we have those kind of beliefs and we have that kind of value of also ourself, like, guess what? I'm going to be my own best friend, and we wouldn't beat up our own best friend if they have slept. We'd say, hey, what do you need to get back on track? What can help you there, and move forward, and not have, be burdened by a lot of guilt or shame. That doesn't end up helping move us forward at all.
For sure. And I definitely believe, not that you need to have a major health crisis to actually take things seriously, but in my case, it's definitely helped because I know I don't have a choice. If I want to have the best quality of life as I can, I need to be healthy. I need to be eating as best as I can. I need to be exercising regularly. I was in physiotherapy actually just up until this past September, relearning to walk. And I went from being in a wheelchair to being in a walker to now indoors. I don't need anything. Outdoors, especially in the winter, I will use a cane, but I am needing to rely on it less and less, which is powerful.
That's very, very exciting. And I want to say that in my own health history of having been blind for over 5 years, that I think I shared with you, that I had recently gone to my low vision optometrist, and he had said even my eyes had improved.
Yeah, well, that's
one
exactly
level after in the past year even.
Yeah.
So it's quite amazing, and yet I aged in the last year as well. Getting older and hearing that your actually eyes improved is really pretty exciting. I mean, our body does amazing things in its desire to heal.
It does.
And we have to
Your body
fuel
wants
that.
to help you. Your body wants to be healthy and strong.
It does.
So
yeah.
we can either help it or hinder it from reaching those health goals.
And really it comes down to the fuel, that foundation piece that we can offer.
Exactly.
So that we can handle whatever comes our way and make the most of it, you know. Mm-hmm. And being able to access acute medicine is really helpful and useful.
Yeah.
But without that food and that foundation, a lot of people will not get the healing that they need to get.
That's exactly it. So the acute medicine is crucial in stopping the attack and getting you starting to be stabilized. But in terms of long-term recovery, long-term health, your diet is the most important thing. And once I started learning about that and how specific, you know, nutrient-rich, antioxidant-rich foods could actually help with cell repair and, you know, remyelinating, so fixing and starting to heal all those nerves that have been damaged, that's when I really took it seriously. And like I said, my symptoms are very, very minimal or virtually gone.
Right.
So I had major fatigue.
I'm hoping that other people, who are coming to our 2020 Fork Smart Summit, will actually say hello to you.
Oh, that would be amazing.
We know that you have you're still recovering some of your vision, so we're going to have you in the front row seats.
Thank you. I appreciate that.
So that you can see everything. And so I hope that I hope you'd be comfortable if some people want us to come. Oh,
absolutely. Feel free to please come say hi. I may not recognize you, of course, but if you say hi to me, then absolutely. That would be amazing.
Right. Well, and I think that's the exciting thing about the summit is that while we see a lot of the doctors that will be coming, like Michael Greger, Colin Campbell, and even Shane Williams, maybe on videos, it's really like being in a live concert when you get to see them in person. But the other thing is that, and people forget, is just meeting other people in a larger community and hearing their stories and being inspired or getting ideas from them. That can really help fuel our motivation to keep propelling us forward.
Oh, absolutely.
Because this is, we've introduced the new Canada Food Guide where we don't have dairy on it.
Which I know was definitely a struggle and took a long time.
Huge, yes. And we also have the list of protein, and we talk about, they don't differentiate, but they acknowledge plant protein on there as well, which is very important. It's getting its due credit for its nutrition value.
That's right.
But it's hard because, as you said, you recognize in your own family that your dad is a carnivore and proud of it.
Yeah.
And we are going to have other people that there'll be kind of a divided table, that they will want to eat their way and we will want to eat our way. But it doesn't mean that we can't share certain things.
That's exactly
everybody benefits from eating some vegetables and fruits.
That's what I tell my dad. I know I'm never going to turn him plant-based. As much as I wish that would happen, because I know it would help his conditions. I say to him, even if you just increase your vegetable intake, decrease your meat intake, that will help you so much.
Yeah. And I think that's the kind of loving attention that we can give other people, is just being able to have them taste the wonderful salad and the oil-free salad dressing. And
that's one of my favorite things to do, is cook for people and have them be like, oh, this is vegan or this is plant-based. This is delicious. And I'm like, I know.
Win them over with their taste buds.
Exactly.
So I want to thank you for your time today, Megan.
Thank you so
much for sharing with all of us your story and your ongoing recovery. It's like really amazing. And I hope we'll be able to have you back again and sort of check in with you and see how you're doing.
Yes, that would be wonderful. I do want to say, I know how powerful it can be hearing other people's stories and experiences, especially with MS. It can be a very isolating disease. So even if people's stories or their diagnosis maybe wasn't the same as mine or maybe wasn't as severe, I always like to hear other people's experience and what they've been through. Right. So I encourage people to leave me a comment on my YouTube or my video and just share your experience with me.
Wonderful.
And things that would
be great, because there's a lot of people suffering out there.
There are.
And we need that community. And for them to hear, I know as a patient, be given a very severe diagnosis, it's wonderful to feel like I can do something to empower myself.
Exactly.
And when I hear a fellow patient saying, hey, I'm going to find ways to empower myself as well. And I found it through food, to be honest with you.
Yeah,
it's
one
quite
of the
amazing.
few things that we can control, I think, is our mindset and what we put into our body. You know, something horrible happens to you. I think you have two choices. You can either lie down and just accept defeat, or you can say, no, you know what, I'm going to fight this as much as I can. I'm going to do whatever I have to do to help myself and get back to my life.
Yeah. Well, thank you very much, Megan,
so much,
for
Kate.
really standing up and sharing your story. And I'm looking forward to seeing you at the 2020 Fork Smart
Me too.
Summit.
I'm so excited. And I hope everyone will make an effort to come, because I think it's going to be pretty wonderful.
I think so too. Thank you so much.
Thank you so much, Kate. Take care.